I'm Jim Gutman, an endodontist and educator from Dallas, Texas. Let's take a look at obturating this molar after it's been shaped with the TruShape instruments. The canals have been shaped and we are picking up the case during the final irrigation. This is the time for the trial fit of the master cones. The cones are always seated in a wet canal space. As we all know, the irrigating solution acts as a lubricant, the same way that your sealer will act as a lubricant when doing the final placement. Size 30 TruShape cones are placed in the mesial canals. A size 40 TruShape cone is placed in the distal. Tug back feels good in all the canals. As we watch the sealer being placed, let's talk about tug back. We are confident with our sizing being just in the apical area because the TruShape cones are sized to the smallest potential shape that the matching TruShape instrument can make. Experience tells us that the canal anatomy is going to be larger than this nominal size as we move coronally. I'd like to point out that the sealer being placed in one of the mesial canals can be seen backflowing into the other through this view through the microscope. This confirms what a CT scan indicated preoperatively. Here, the first gutta-percha point is being placed. The head has been removed to facilitate vision and to allow enough space for the cone in the adjacent canal. Here is the cone for the second canal. It looks like it's coming up short, but we know it's going to be to the right depth because it is meeting that communication point between the two canals. The heat carrier is introduced, and the coronal portion of the TruShape gutta-percha point is removed. The heat carrier is introduced into the other canal, and that cone is severed. A small pre-fitted plugger is used to compact the apical plug in each canal space. Be patient with this step in the process to ensure good apical adaptation. Work the material deliberately, allowing it to move into the space. Let's turn our attention to the distal canal. Sealer is being introduced. Based on the anatomical norms for a mandibular first molar, as well as the way the space was instrumented, this canal presents a large buccal to lingual shape. Therefore, plenty of sealer is placed. The final TruShape instrument in this canal has a size 40 tip, so a corresponding size 40 TruShape gutta-percha point is placed to length. Notice that the coronal aspect of the point has been removed here also. The width of the canal dictates an additional cone be placed alongside the master cone. In this case, a standard size 50 is selected to fill up all of that space. The heated instrument is introduced and driven deeply into the gutta-percha and held there for a couple of seconds. Another burst of heat and some gentle rocking, and the cones are severed. A plugger, pre-fit for the distal canal, is used quickly to compact the gutta-percha and create the apical plug. With all the canals having good apical adaptation of the gutta-percha, it's time to do the backfill. You can see in the mirror that the distal canal is done first. The pressure is allowed to float the needle coronally. The plugger compacts and adapts the still warm gutta-percha. It is first worked circumferentially, then from one side to the other. The mesial canals are next. Again, back pressure carries the needle coronally. This step should never be rushed. Let the flowing gutta-percha move your hand to the desired height. In addition to simply compacting gutta-percha, the tactile response of the plugger provides clues about the quality of the fill. Each press, each wiggle improves the adaptation of the material. Now the other side of this mesial system. It doesn't take very much, and the space is filled. The plugger is brought in one final time to complete the obturation. As important as filling the canals is, without a good seal, all this work could be for naught if bacteria are allowed to penetrate. So in this case, a good restoration is placed immediately, giving this TruShape case an excellent prognosis. Thank you for your attention.